Our next speaker comes from West Germany, and we had the privilege twice last year to visit the Schwarzwald Clinic, and we were quite impressed with what we saw. You're going to see some very dramatic pictures in today's presentation, and for many people, I'm glad that the breakfast time has passed, because you are going to see, again, very dramatic pictures of people with all sorts of allergies, skin problems. Both Laverne and I, when we attended the clinic, had the opportunity to see the type of patients that you will see in the slides today. And we were very impressed and were very moved when we realized just what was able to be done for these people. And we feel very fortunate that the clinic has agreed to send a speaker to us to give an explanation and to show you what is being done for quite a few skin problems that, quite frankly, especially in our country, seem to go really are untreatable. Also, I would like to add that our speaker has really done a fine job, and for him to volunteer to speak in English for us, which again is not his native tongue and has not ever been in the United States before, allows us all an opportunity to hear something that we normally would not hear. So I would now like to introduce Dr. Sawatzki from the Schwarzwald Clinic, who will give you the next lecture.
My dear ladies and gentlemen, you have heard it's my first day in the USA, my first lecture in English. And there are a lot of words which I don't know, a lot of words I have forgotten. That's really a pity, because I love the English language. I would prefer to speak free without manuscript, to make some jokes very dryly in between, as Dr. Thompson has done on Friday, to give a lecture in a temperamentally manner, just as Dr. Lett had done, or to speak in the combination body and spirit, as Dr. Van Duck has done. No, I have to take the manuscript, and I will try to do my best. And there's another snake. I'm an extremely uncomfortable doctor, you have heard it. So besides of the boring lecture, I want to show you some slides. They are sometimes awful nice in a double sense, you will see. It might be difficult to sleep too long, too good. But next point, the thanks. I give my thanks to Mr. President, Stephen Ross and the World Research Foundation for the invitation to this lecture in Las Vegas. I wish that you can take some ideas and inspirations home with you for your own work as a doctor. And I think I have equally to give my thanks to God Father for being a doctor, to work as a doctor, and for the possibility to speak to you. Every person ought to be grateful for his life, and it seems to be silly or foolish to say this. Each human being should be grateful for accidents, chronic and acute diseases he had to endure in his life. These events never should be seen as merely casual. After my personal opinion, these accidental events are always signs and hints for us. For example, Godfather, sitting in the armchair, is saying with lifted forefinger, "Dear Stephen," or "Dear Carl," or "Dear Kai," that's me, "don't be silly, don't be lazy any longer. Get up and start changing your life at once." You small little human being always have the free decision what you want to do. But me, God, wants to show you through accidents through symptoms of diseases that you should change your previous manners of eating, of working, of living, of thinking. Thus, my dear ladies and gentlemen, people which suffer from chronic diseases or which have other chronic diseases of the skin or other diseases, or which have other points of bodily weakness, are favorized by God. They get their necessary hints every day. This in contrast or in opposition to our politicians. They are mostly well-built, sometimes fit, at least in Germany. They have very good nerves, very good function of the intestine, the stomach, the liver. So it's not easy for them to think over problems very deep, to change their opinions. We can understand them very well. And so, for example, we have nice, fine-working atomic power plants spread all over the world. You have heard I'm treating patients which suffer from neurodermatitis, allergies, hay fever, asthma. I have to observe very curious things every day. Those who won't change themselves, who won't solve their problems in private or in professional life, they always have to stay some weeks longer in our clinic. 3 or 4 weeks longer. Something to think over. Today we live in an age in which almost everything is exchangeable, replaceable, or at least completable. It's not only that we put in artificial teeth, we are also quite good at installing artificial joints and even transplant organs. As far as cell metabolism is concerned, we get better and better in compensating the lack of minerals and vitamins and other vital substances. Mostly we give artificially composed combinations of vitamins and trace elements. We even add amino acids, single or combined, to our food, and for years or even decades we have practiced the art of prescribing antibiotics, analgesics, cortisone, and psychopharmacological agencies. In Germany, the United States were always supposed to be the country of infinite possibilities, so especially in the years after the Second World War, in the 50s and the 60s. In some respect, they were thought to be a paradise where everything is possible. And as we heard it yesterday, it is nearly everything possible. Possible, for example, that you cannot work with fever therapy here in the United States. If we take a look at the whole world, all the industrial nations seem to be places of infinite possibilities for the economically behind developing countries. And still we, who may live and work in such apparent fool's paradises, we experience new dimensions of other limitations. These limitations have hardly been known, hardly been expected nor accepted for true. We get to know them in the changes of the clinical pictures of diseases, but also in the frightening increase of certain diseases, so for example, allergies, asthma, neurodermatitis. The allergic genesis of hay fever is known, but it is not all. In the sense of our colleagues in former centuries, we can say it's a poisoning of the blood. The same for neurodermatitis, for skin diseases, for other diseases. As far as neurodermatitis is concerned, there are 60% pure neurodermatitis patients and 40% combinations with different allergies in Germany. This according to the university publications. After my opinion, it's more. I think we see in our clinic the combination between allergies and neurodermatitis to 80%. The disposition to these atopic diseases is hereditary by more than 90%. One parent who suffers from asthma, hay fever, or neurodermatitis, or else psoriasis or ichthyosis, means that the possibility of passing it on is about 30%. If both parents, that is father and mother, suffer from such diseases, the tendency of hereditary transmission is 60 to 65%. Looking at our own observations, that's to say those of the Schwarzwald Clinic, such hereditary connections are demonstrable with a much higher percentage. In our patients with more than 98%. The tendency of sowing it into the third or fourth generation, as it is written in the Bible, can hardly be more extreme. What else do we observe? A clear accumulation of diseases in centers of cities or industries. Striking also that slumbering diseases can be woken up by giving certain drugs or by performing certain conventional traditional therapies, not in the sense of Dr. Maseko, but I mean the allopathic therapies, the therapies of the universities, but also by certain one-sided types of degenerated nutrition. Here you have a very good example for degenerated nutrition. Perhaps we can, it's a nutrition, our intestine is enthusiastic. We get through isolated sugar an amount with candidiasis. 80% of our patients suffer from candidiasis. You see the connection to the nutrition on the one part, and the other part is the allopathic therapy, cortisone, antibiotics. An increase was also noticed when there was an atmospherical change, for example after nuclear reactor accidents like Chernobyl, for 5 months. But all that, the human beings of the enlightened age of infinite possibilities, the 20th century, don't want to take for true. Nevertheless, daily our attention is called to such connections as patients and doctors, and we are shown our limitations here on the earth. Highly uncomfortable is the realization that you can only give effective medical help that lasts if we correct the people in their nutrition for most of our patients. My dear ladies and gentlemen, you did hear that correctly. A change in nutrition as a basis for the treatment of such diseases is necessary before we can start the medical therapeutical part. My teacher, Dr. Walter Zimmermann, one of the most well-known German doctors of naturopathy and homeopathy and internist at the same time, didn't allow and did not allow till now that patients who have been treated with cortisone before can come in his clinic for naturopathy in Munich, a clinic dating from 1880, not the building he's working in, but the first. The way back, that is to a cortisone-free therapy based on naturopathy, would be too difficult for the patient and the doctor. And this is right. A young woman, especially the face, and if we have the face, if we see a face in this manner, there's often connection with sinusitis or the teeth. But my desire to try the difficult, the apparently impossible, on a bigger level stirred me up for years. I knew that naturopathy, no matter what kind, say acupuncture, homeopathy, physical therapy by Kneipp, Mora therapy or color therapy, phytotherapy or classical emitting methods by Aschner, each of them on its own or in combination with each other, that all these therapies rarely have lasting success. A woman, 42 years old, degenerated foot, cigarettes 20 to 40 each day, cortisone cream twice a day. This is stage, the third day in our clinic. The patients are not allowed to use any cream in our clinic. And here you see the itching symptoms. And I show you the next picture, it's quite interesting. The nails, very long nails, and the hand. The first step towards realization of this consideration was possible in the Schwarzwald Clinic. It's a fight against the increasing atopic diseases. As far as nutrition was concerned, we first considered a pure vegetarian food to be the best way. A whole meal nutrition with raw and heated, that is cooked, fried or stewed food. We started with cereals for breakfast, for lunch first a salad, then different kinds of savory vegetables, together with grain, rice or potatoes. Afterwards, dessert made of fruits, possibly mixed with almond puree or almond milk, soy milk, perhaps for sweetening honey or maple syrup, perhaps some seasonings like cinnamon or vanilla. Isolated sugar, of course not. In the evening, salad or vegetables usually cold or stewed. Of course, no alcohol, no coffee, no black tea. In connection with the medical therapy, this diet had good results. Allergic skin conditions were decreasing, itching could be soothed. Cutaneous eruptions, asthma, and allergies diminished clearly in their intensity. However, there was one snag in this kind of diet, a snag the patients that wanted to come to us had to overcome first. It's a diet without any animal protein, no dairy products or cheese, no meat. Not only pork was omitted, but also poultry, lamb, veal, and beef. These victuals were strictly omitted because we observed them to favor the tendency of itching, the tendency of inflammations, no matter whether chronic inflammations are supported or new inflammations arise. As far as milk and dairy products are concerned, I have to add that up to the age of 7, our body is quite well able to digest milk with the help of the so-called lab ferment. But even this varies depending on the constitution of each person and on the functioning of different organs. 30 to 40% of the Europeans are supposed to have an incompatibility to milk of the cow, and it's even black people, and 85% of the patients, of the white persons who suffer from neurodermatitis. Interesting enough that for some patients just the renunciation of milk and dairy products, soothes their bodily symptoms. In the Schwarzwald Clinic, we usually don't give any animal protein, with the exception of butter and cream sometimes, which are tolerated mostly. This, however, depends on the given amount, say on the dosage. A very important sentence for the treatment of neurodermatitis and allergic diseases. The poison depends on the given amount. This observation corresponds with the well-known phrase of Paracelsus, a famous European doctor of the Middle Ages who noticed that small doses stimulate or build up and big doses harm. That is, they often release diseases or keep them going on. 1.5 years later, we went one step further on our nice and peaceful nutritional path. We left vegetarian food with cooked and raw material besides or behind, and started a pure, fresh diet with most of our patients. That's a food preparation of only fresh material, not cooked, not fried, not stewed. This was first recommended by our nutritional advisor, Mr. Spiller. The doctors looked at his recommendations very skeptical at first. Also for the patients it meant a further mental changeover, cereals in the morning or fruit pulp with mashed grain germs, and possibly carrots. For lunch, a big plate of salads or raw vegetables plus a corresponding dessert. In the evenings, mostly raw vegetables. In between, infusions of herbs, water, and possibly some fruit or vegetable juice. Terrible. This change of diet was carried out because we thought that we had to influence cellular breathing and the disordered cell metabolism and, of course, the immune system in an even deeper manner in order to supply our body more plentifully, finer and better with missing vitamins and minerals. Thus, germinated sprouts are added to the meals. For example, a handful of germinated lentils. You see a container that you can put the seed in, and then you take water twice a day and you see the sprouts are coming. Or certain parts of the salad are changed in taste and revalued as far as the contents of minerals and vitamins are concerned by mixing with different germs. For example, finely rasped broccoli together with germs of azuki beans, or a salad of celery mixed with some chickpeas. A change of thinking and of testing was demanded. Now in the beginning, often strange and unusual tasting mixtures had to be created. The cook had to make a lot of experiments, and not every experiment was a success. After a shorter or longer lasting changeover of the gustatory nerves, however, more and more patients accepted it more and more willingly and interested, but in truth I had to add, they know that it is the basis of the therapy and that it has success. This could be observed in all ages and also independent of sex. Of course, people who had eaten a lot of meat up to their admission, as well as too much jam, sugar and products of refined flour, people who had happily unconcerned smoked their cigarettes or cigars, had more problems with this food. The third gustatory nerves of the tongue needed an intensive cleaning. A longer time of alteration and changeover was necessary. The stay in our clinic usually lasts 4 to 6 weeks. For the severe cases, 8 weeks, 10 weeks, seldom 12 weeks, very seldom. The time of changeover, including the body becoming familiar with the animal protein-free fresh diet, is longer too, maybe 8 to 10 or even 12 weeks. For about 120 days, that is for 4 months, this strict form of nutrition should be followed. The background idea is to change the program of the immunological system and to have a renewing effect on cell metabolism, this according to the ideas of Dr. Seeger. In this time, each person decides anyway on his own whether he or she has become used to the diet and wants to stay with it, or whether he slowly, carefully, and step for step wants to enlarge towards whole meal food. Later on, some people can actually eat meat and dairy products. So much, but I have said some people, not everybody. So much we can tell now, observing our patients for the past 4 years. To give you percentages in a statistic tabular form today still seems a bit too early. After my opinion, it's about 20% who continue for more than 1-2 years with a fresh diet, raw diet, without cooked rituals. Due to this change in diet, together with some biological and homeopathic medicine, the sick people get into a crisis of alteration and elimination of the skin or the body. In the sense of the former colleagues, I have said it, we have a blood or a milieu which is poisoned. In the antiquity and the Middle Ages, our colleagues have treated according to the sentence, the milieu is all, the microbe is nothing. The modern medicine of the university is treating according to the sentence, the microbe is all, the milieu is nothing. And now you see some reaction of patients which have been treated with cortisone antibiotics for some years before coming to our clinic. They come to our clinic in order to get rid of the university therapy. There are a lot of Germans which want to get rid of cortisone and antibiotics and psychopharmacological agents. Yeah, we have this crisis of alteration and elimination. It showed that seriously ill patients reacted with a clear aggravation of the skin, often in combination with fever, within 2 or 3 days. The usual time for 60 to 70% of our patients is 7 days. 7 days. This is a young girl, 23 years old. When we have neurodermatitis only at the hands, we can say that the patient has problems, especially with his spirit or soul, that he has problems and he has to solve them. 20 to 25% react within 2 or 3 weeks. and the other 5 to 10% within 6 to 8 weeks. Honestly, so far I don't know one single case without any bodily reactions of elimination sooner or later. Comprehensively, we can state the following for young as well as for old people. Each person experiences an eliminative reaction, not also in this hard manner. There are only few persons. It happens by a temporarily emphasized functioning of the skin, sometimes of the intestine, seldom the kidneys. Everybody does it according to his personal constitution and disposition, also depending on the traditional or natural medical treatment he had had so far by his general practitioner or dermatologist. Here you have the connection, right side, liver. A young woman, she has taken for some years pills, anticonceptiva, birth control pills. Yeah, she has taken birth control pills, and you see the reaction about the right side. Apropos dermatologist. So far I know there are only 2 female doctors in Germany who carry out dermatology in a mostly naturopathic, homeopathic method. The rest, that is 2,998 doctors, treat the usual conventional way. Even if they know about alternative possibilities, in reality it's left to general practitioners and some rare internists, as me, to use a biological treatment on skin diseases. It's getting better and better after the stage of pyodermia. You have to see that in the context that skin diseases don't stand separate from the rest of the body, but are a reflected image of internal disorders of metabolism. In our clinic, next, that's a stage when a patient leaves the clinic and is getting better and better over weeks. Sometimes it lasts for months. Depends on the constitution and the weakness of the liver, the intestine, the problems of the soul he had had. These are the hands we have seen before. In our clinic, the change in nutrition for adults is started with a fasting cure lasting 10 days mostly. During the day, different infusions of herbs and low mineral water are given for drinks. Besides, for lunch, varying juices of vegetables or fruit. Very important, the water. Sometimes you have attacks of itching, especially in the afternoon, and you can diminish the itching attacks by drinking low mineral water, good water, not the water as here in Las Vegas. Oh, one moment. I have to. Yeah. The mainly treated patients. No, don't. Children and youngsters up to about 17 or 18 years don't fast as an introduction. The patients really get an abrupt changeover in nutrition. That is, we start directly with a fresh diet. Certainly, some of you are questioning whether these patients have to stay any longer for these reasons. Interestingly, I can't answer with a clear yes. If at all I want to make a separation of certain states of age that rather need a longer stay in our clinic, I have to mention the following. First, babies and small children up to 3 or 4 years. The immunological system hasn't yet developed completely. Moreover, there is the stronger rejection of the change of the diet, possibly also the refusal because, that's not good, because they find it impertinent. Here a lot depends on the good interaction between mother and child and how they see their time in the clinic, whether it's a bigger, longer-lasting fight for might, which means that not only food is concerned, or whether it's a smaller transitory struggle between the different partners. Patients who suffer from neurodermatitis, special sort of people. Sometimes we have children which are fighting like tanks in the war. Sometimes we have mothers which are overprotecting like a spider over their children. The second, elderly people. I beg your pardon, but out of my view, elderly starts about at the age of 45 years. It's a point my wife doesn't like to hear it, but she doesn't suffer from neurodermatitis. These people often have had years or even decades of cortisone treatment. Nutrition consisted of mainly degenerated food or food treated hormonally or chemically with fertilizers or pesticides. Pesticide, yeah, with very nice slide. A herb treated with pesticides. A herb for the treatment of wounds with antibiotics, substances. It would be very interesting to eat this plant and to notice what reaction we will have. Furthermore, they have beginning or progressed dysfunctions of certain organs. Sometimes that plays an important role. Liver, pancreas, kidneys, intestine, stomach, skin, and immune system. Here I have to add that after the fasting cure, adults also change over to a fresh diet. This happens within 2 or 3 days with slowly increasing amounts of vegetables and fruit, and later on cereals in the morning. At the same time, it's important to observe, or rather to relearn, the slow, careful chewing. Another important thing during this alterative time, but also for the rest of the life, is the attention to a daily evacuation. In case of doubt, enemas, phytotherapy, Epsom salt or Glauber salt should be used. Besides the change of diet, how do we treat at all? Which procedures, what drugs are used? As for medication, I can make it short. Homeopathy with herbs, minerals and animal products. As for phytotherapy, herb fusions or tinctures for internal and partly external use. What comes next is a classification of different therapeutical methods we use. I want to show it to you on this slide. Saying more about all these methods, you wouldn't have room in this lecture. However, I want to talk a bit more about draining and alternative procedures that can also bring about constitutional changes. What I mean is the renaissance of methods of the antiquity, of the early and the late Middle Ages, up to the beginning of the 19th century. These methods are known in Germany as Aschner procedures. Aschner was a great gifted doctor and researcher of the century, and diligently and with verve he searched through all scriptures dating from the past centuries way back to antiquity, written by our medical colleagues. Hereby he compiled methods that he thought to be worth reviving, dragging them out of the grave of the eternal oblivion. Some parts of these procedures seem strange, and as a doctor you have to bring yourself to apply them for the first time skeptically. The success Aschner talked of is no nonsense or pure fantasy. It can be repeated in our times too. Aschner had worked in Germany, Austria, Great Britain, the United States of America. In these countries he is hardly known. There are only a few living colleagues who engage in his work theoretically and then practically on the patients. Let me say a few words now to some of his techniques, looking at the following slides. I hope that this short information, that this survey can wake your interest and encourages you to study for yourselves, to imitate or even exchange your thoughts and ideas with us in Germany later on, if you like. In any case, I am always willing to help you on, although it might be a slow and bumpy path in the beginning because of my nice English. Venesection. The indications for venesections: first, polyemia with the symptoms headache, sleeplessness, sweating stage, tinnitus, nerve and retinal bleeding, shortness of breath, asthma, brachialgia, hemorrhoids, varicoses. Second, tendency to inflammations of inner organs like, for example, pneumonia, pleurisy, hepatitis, cholecystitis, pericarditis, ethnic-citis, epididymitis. Then, the third point, refractory psychic disorders, also psychosis, manias and depressions. Fourth, what the former doctors called poisoning of the blood or the humoral system, no matter whether acute or chronic. So every acute infectious disease can be seen as an acute poisoning. How is venesection carried out? Of course, the patient should be lying down. You use a cannula with a wide lumen and a sphygmomanometer cuff for compressing the vessels, not this tourniquet. I don't like them. It's much easier to regulate the pressure on the arm with a sphygmomanometer. How much blood do I take? 50 to 200 and 200 cubic centimeters at the most at each treatment, mostly between 120 and 180 cubic centimeters. You can make a venesection too when you have a patient who is poisoned with drugs. It's very interesting and very good success. Acute diseases, I have to add, mostly I take between 120 and 180 cubic centimeters. Acute diseases require bigger amounts of blood, 180. Chronic diseases, rather small, repeated venesections. Microvenesection. Here you see on this picture a Thai, a woman 60 years old, and there you find small dilatations of the vessels, here, here, there. A woman, she's suffering from psoriasis. Where is microvenesection carried out? Everywhere where you find small varicose dilatations of the cutaneous veins. I repeat, everywhere. Experience tells us quickly where, when, and how often a microvenesection should be repeated. How is it carried out? The patient should be lying or sitting, maybe supported by a helper. Where? The best place is a couch. If I carry out the therapy with the patient sitting and he gets a circularity insufficiency due to psychic interactions, I can lay him down quickly and hold his legs above horizontal level if necessary. Our tools: sharp, three-edged needles, sodium citrate, sterile swabs, and a watertight base should be put underneath. The puncture is carried out with a turn of 80 to 90 degrees in the tissue. You see the needles? And I take them, and then I make a turn of 80 to 90 degrees in the tissue. Immediately afterwards, a helper wipes the point of puncture with a swab soaked with sodium citrate. So the microwounds bleed longer and stronger until there is no more hypertension in the capillaries. Microvenesection results in less congestion in deeper blood vessels and sets the obstructed, blocked metabolism in motion. Locally, it results in the healing of eczemas, rashes, cephalgias, brachialgias, and arthritis. Over and over again, the positive results are amazing and not only referring to our body but also to the soul. Aggressivity, depressions, neurotic and hysteric disorders, and even schizophrenic tendencies are diminished and sometimes even disappear. Out of my experience. What I said above is also true for normal venesection. Venesection and microvenesection have a decongestive and relieving effect, also blood purifying and alterative with a positive influence on body and mind. I have said everywhere, the upper part of the column, cervical part, and there is a connection to the womb of neck and ovar. The pelvis, no, the ovaries. Yeah, the ovaries. When the women have taken the birth control pills for years, and you find sometimes these dilatations of the vessels in this region, and you have to treat them. Baunhtscheidt's acupuncture treatment. Acupuncture, of course, yeah, you can say a sort of European acupuncture, but only in comparison. We just talked about venesection of the blood system. Now, Baunchtscheidtism is a kind of venesection of the lymphatic system. What do we do? With a skin stitching instrument, I stitch certain regions of the skin in a delicate or strong manner, depending on the constitution the quantity of muscles, on the type of the skin, and of course also on the sensitivity of the patient. A tender, rosy skin like a baby's buttocks is treated carefully. A firm, yellowish-gray, thick skin like an elephant's skin is treated more powerfully. You also have to take into account whether you want to have a milder or more significant effect on the skin. After the stitching of the skin, there are 3 possible procedures. First, the application stays dry and should be repeated frequently, every day, perhaps. Second, the punctured area is creamed or oiled with ointment or a fluid that is more or less irritating the skin. Here you see the instruments. The instrument we are using in the clinic, and that's the old one. And different sorts of oils. Yeah. And third, the procedure I just talked about is carried out with different substances, one after the other. Afterwards, the area is covered with a special absorbent cotton wool, and a plaster is applied. This covering stays there for 3 or 4 days and is then taken off. If you proceed without oil or cream, the skin either doesn't show any reaction or only a scanty erythema. Rarely you can find mild fugitive quadrils. If repeated more often, the skin reactions might get stronger depending on the patient's constitution and the allopathic treatment he had had before. If we proceed as told in number 2, a well-reacting skin shows a short-term, discrete or more obvious erythema with interposed quadrils or different intensity, again depending on the patient's constitution and the medication he had had before. If there is an extreme unresponsiveness of the organism, 3 or 4 applications with a Baunhtscheidt instrument plus an ointment may be necessary to make the body react in a satisfying way. If we proceed as told in number 3, pustules of pinhead size develop together with subliminal formation of pus. So this is a stronger drainage and alterative effect. What can I bring about with the Baunhtscheidt therapy? First, independent of skin diseases, we can relieve and possibly even cure acute and chronic uritis. Second, flabby and sluggishly functioning organs can be strengthened and stimulated indirectly by working on the according reflex zones. Third, it's a mild drainage and alterative therapy, and the effect can be well dosed by alternating frequency and intensity of this therapeutic procedure. Fourth, the drainage and alteration doesn't only act on the body, but also on the mind in a positive, stabilizing way. And the fifth point, indirectly I can influence the hormonal regulation of the body too. Indications can be deduced from what I said above. I especially apply this therapy to rheumatic diseases, neurodermatitis, asthma, bronchitis, but also allergies. Furthermore, I use it on patients suffering from flu, dysmenorrhea, amenorrhea, cephalgia, and migraine, obstipation, chronic tonsillitis, and psychic instability. Cantarital blaster. This blistering plaster with the body of the so-called Spanish fly really has an effect like a venesection to the lymphatic system. The usual venesection of the blood vessel is called the red. This one is called the wide venesection. Exactly cut plasters of different sizes can be applied to the skin wherever necessary. Using these canteridal plasters, it's necessary to know where they should not be applied. That is near mucous bursae, on tender skin like the bend of the elbow, the bend of the knee, inguinal region, the mamilla, and neither directly on bone structures. Where do we apply it often? Under the left clavicular, you see it on the slide. That is the orifice of different lymphatic vessels into the aorta. Also on the sides of the neck or on the duke or behind the ears. Here, in this part, and a paravertebral along the vertebral column, on the liver, the pancreas, and the stomach directly. At the inside of the thighs, in order to have some influence on persistent amenorrhea or to drain processes around the knee or lower legs. Furthermore, on the inside of the lower legs, mostly in the area of the acupuncture point kidney 7, in order to act on processes of the foot or the ankle. Also interesting, the area of the fifth lumbar vertebra or the sacrum if you have hormonal hypogastric disorders or local congestion or a heavy depression. But always you have to speak with the patient before, because it's not a very nice therapy. With this painful, strong method, all scarifications in joints can be dissolved. Post-operative complaints connected with scares can be soothed or even removed, and also periarticular and capsular spasm can be eliminated. Actually, it's also possible to resorb exudates and deposited metabolic waste products. Pleurisy can be treated with canteridal plasters as well. However, I do prefer mustard fermentations in the early stages. They are analgetics, stimulating the blood flow and indirectly have an antibiotic effect. But when the pleurisy persists, I use canteridal papers as well. You leave these plasters on the skin for a varying amount of time, again depending on the patient's age, constitution, sex, skin condition on one hand, and on the milder or stronger drainage effect I want to have on the other hand. At the average, at least 4 up to 24 hours maximum. 4 hours for children and 10 to 18 hours for adults. 24 hours very seldom. Then a burn blister has developed that has to be tapped if the blister is uninjured when the plaster is taken off. If the blister has ruptured, the skin is removed locally to prevent suppuration, or rather a hesitating healing process. The follow-up treatment consists of a sterile... No, das war falsch. Yeah, see. The follow-up treatment consists of a sterile dressing with Nivea or better an ointment of calendula or hamamelis. This bandage can stay for 2 or 3 days before you change it, but only if there is no visible excreta. We notice with our patients that metabolic and chronic inflammation processes that had been blocked before now lead to an intensified local lymphatic drainage for 1 or 2 days. This, of course, needs a more frequent change of bandage. If the process is acute, the exudate is clear. If the process is old, chronic, it's often yellowish, thick. Using the canteridal plaster therapy, we can observe as well that as a result there is not only a positive physical interaction with drainage, relief and stabilization of the immunological system, but also a curing, cleaning and putting in order effect on the psychic field. It's a therapeutical method which shouldn't be underestimated in its cleaning and alterative effect on body and mind. Often enough, it brings quick, visible success to patients and doctors and makes them both breathe again. In that case, we use these pretty nice animals, leeches, mostly 6 to 12, that are put on the skin at the border area of inflammations, by the way, for abscesses too. Each leech drinks about 8 to 10 cubic centimeters of blood and gives Hirodin and his own bacterial flora that has good antibiotic qualities into the blood at the same time. The same leeches 1 hour later. The therapy lasts about 1 or 2 hours, sometimes 3, depending on the fitness of the animals. Afterwards, a secondary hemorrhage out of the bite follows, lasting between 2 and 24 hours, mostly 6 to 12 hours. This shouldn't be blocked artificially. What can I achieve with the leech therapy? Decongestion, removal of old, so to say, used up, wasted blood. At the same time, viscosity is reduced. Indirectly, there is a positive influence on the immunological system and, of course, again on the psyche, with soothing of depressions, aggressivity, with a releasing, quieting effect on the patient for a lot of days or weeks. Yeah. Afterwards, a woman, 75 years old, severe generalized neurodermatitis, a lot of cortisone, iritis, and the ophthalmologist, yeah. He wants this wife to go to the university to get a treatment with cortisone and antibiotics, but she doesn't want. And she stays in our clinic, and we make a combination: diet, homeopathy, and this leeches and canteridal plaster therapy in this place and here. It's a pity I haven't had the time to take a new picture. It was in the last weeks she had left us. All is good. The bites or the wounds of the leeches are 1 day after in the region of the liver. Very typical, these stars. Out of the group of other external procedures, I would like to recommend one other therapy warmly to your care. You might know it already. What I am talking about is the massage of the reflex zones of the feet, a therapy that came from the United States to us to Germany. I have had heard that this method isn't really estimated anymore in its homeland, or rather it's not known anymore. In the 17th, it was also smiled at in our country, and only some highly reputed nature doctors used it in a hesitating way. During the past 10 years, some colleagues have recognized the importance, however, and learned to estimate the possible effect. So, in the meantime, you can get enough books about this method in Germany, I think more than 10. I myself have learned to estimate the massage of the plantar reflex zones on patients with rheumatic diseases, especially therapy-resistant cervical spine syndrome. Very good. Shoulder-hand syndrome. Very good. Cox arthrosis. Sciatic neuralgia. Furthermore, on hypogastric disorders, migraine, spasmodic states, obstipations, metabolic disorders in the digestive tract, sinusitis, chronic rhinitis, and last not least on our skin disease, that is on neurodermatitis. And again, the positive effect on the mind mustn't be forgotten. It's a method every one of us should get to know and be able to practice at least in a fundamental way. It's a method of therapy which can also be used for an additive diagnosis, a method where we ourselves touch the patient and get into direct contact with him. And we can give him first hints how to possibly treat himself in a simple way. A really effective procedure that can be applied 2 or 3 times a week or sometimes even daily as an alternative therapy. We use it on adults as well as on teenagers and small kids with good success. Before I come to my last page, I want to show you some nice pictures. That's not in our clinic. I should say a young girl treated from one of our universities in the traditional way, the stage before she comes to our clinic. It has been for some weeks. You see the gloves, the itching is generalized. I don't know the word in English, but this is often that the Lymphknoten, Lymphknoten, the Lymphknoten, Herr Walter. Lymph node, the lymph nodes, yeah. It's very often that I see him as well like that. And that's the same girl, 3 days before she left our clinic. Another one, small kid. And afterwards, and so I can continue with a lot of patients. There would be a lot more to say and to show here, and today I wanted to draw your attention to existing possibilities of therapy that have stood the test but have been forgotten long ago. Back to nature in a classical way, concerning therapy on one hand, back to natural, not artificially fertilized, not artificially refined food on the other hand. To study these possibilities of combinations and to use them on our patients daily gives us a delightful detective occupation. So many detective stories come to a surprisingly quick, positive turn. Last not least, my ladies and gentlemen, we are all guests on the earth. Therefore, we should also learn to make use of the possibilities our Creator gave us into the cradle in an appropriate way and to respect the laws of nature. We shouldn't complain anymore when some diseases can hardly be treated at all or only be very long-term therapy. Looking up to God Father, we should first of all change ourselves. This doesn't only mean searching for new technically emphasized procedures, but also rather making a bridge to the formerly known and to the things that proved to be good. Let's remember that there haven't always been cortisone, antihistamine drugs or antibiotics, and that many generations of doctors and healers before us also had to help people and partly even did that in an excellent way, often maybe even better than we. Especially the white race, no matter whether Americans or Europeans, should look respectfully at Chinese, Japanese, Indian, Red Indian cultures, and as we had heard, to Africa too. The white man is a specialist in digging a deep ditch between today and the knowledge of former centuries, between the past and the present. Exactly, the whites seem to have little interest in preserving the knowledge of former centuries, in verifying it and in using it to the best of the patients in synthesis with modern medicine. May God help us to get smarter finally, to reflect, and may He help our children and grandchildren to learn from us in this respect and to change in a positive way. I thank you for your attention and for your patience.
Thank you. Dr. Sawatzki has asked for any of you who have questions that he and Dr. Karl Walter from West Germany will be out in the exhibit area, and it would be much easier to handle and field the questions, and they will be out there right now. Also, I would like to present this plaque from the World Research Foundation and really the effort that Dr. Sawatzki did to communicate with us in English. I wish you'd join me again in applauding his effort here. Thank you. Okay? Bye-bye.